Over the past 50 years, healthcare reform has been a topic of debate amongst political circles. Since Medicare and Medicaid were passed in the 1960s, healthcare has been an issue that both Democrats and Republicans recognized the need for reform, but no one was able to follow through with it. This situation changed during the Obama administration when Barack Obama was elected president in 2008. His main campaign platform of healthcare reform was finally going to be brought to fruition through the Affordable Care Act. This bill was the only healthcare reform policy the government managed to enact since Medicare and Medicaid were passed in 1965.
During Obama's first term, creating a universal health care system was a top priority for Democrats. 6 months after being elected, H.R. 3962, also known as the Affordable Health Care for America Act, or what it came to be known as Obamacare, was introduced by Speaker of the House Nancy Pelosi in the House of Representatives. At the time of the bill's introduction, the Democrats had a 2/3 majority in the Senate, making their bill filibuster-proof. However, by January 2010, following the death of a Democratic senator being replaced by a Republican, the supermajority was gone. This put Obamacare in jeopardy. A coalition of Democratic senators decided to use budget reconciliation in order to pass the bill, because it would only require 51 votes. The Senate's version of the bill passed in March of 2010, and the Affordable Care Act, ACA, was signed into law by President Obama that same month. By 2014, the full rollout of ACA was in place. States were required to have exchanges where individuals could compare insurance prices. Minimum essential benefits were established, and a metallic bronze, silver, gold, platinum covered system was in place. Insurance providers were no longer allowed to use gender, medical history, or pre-existing conditions to set the price for insurance premiums. This means that individuals living in the same state and who are the same age will be charged the same for their insurance policy. In addition, insurers were required to allow children to be covered by their parents' insurance until age 26. Finally, ACA required that all Americans have insurance or be subject to paying an annual tax. From a public choice perspective, a variety of factors came into play in passage of ACA, including rational ignorance and special interest. As a result of ACA, regulatory capture and rent-seeking has continued to occur in the healthcare industry.
The concept of rational ignorance ends up playing a major part to getting the Affordable Care Act actually passed. Kaplan explains it as any situation where individuals know little or nothing because the expected benefits of knowledge are negligible. This can essentially be broken down to a cost versus benefit situation. The cost of knowing something is extremely high compared to the benefits you get out of a said situation. The public was either too misinformed or completely uninformed of the true cost of the Affordable Care Act due to the American voter being rationally ignorant. Gruber, who was sort of the mastermind behind helping write the bill, said how the stupidity of the American voter made it important for him and the Democrats to hide Obamacare's true cost from the public. This helped show that the idea of the American voters was stupid, or in other words, just rationally ignorant. This meant that those who were wanting to get this bill passed were betting on the fact that the American voters were misinformed in order to get the Affordable Care Act passed. That means the idea that Americans didn't have the full knowledge and remained ignorant because of the cost of knowing severely outweighed the benefits they would get. This means that the Affordable Care Act was made to be hard to understand. Gruber points out again that it's that law's complex system of insurance regulation is a way of concealing voters what Obamacare really is, a huge redistribution of wealth from young and healthy to the old and unhealthy. Thus, we can see from this that the entire strategy to get the Affordable Care Act was to mislead the American voters to vote on one thing, while in reality getting something completely other.
Now, before the Affordable Care Act could be passed into law, the Obama administration had to generate enough support for the bill. This is where the role of special interest groups came into play. A special interest group, by definition, is a group of people connected by a shared set of policy concerns and goals. These groups are also more likely to support candidates and legislation that promise to provide their group with special benefits or privileges. These benefits are concentrated on group members, and the cost of such privileges are paid for by the rest of the uninformed voting population. Special interest groups are useful to their explicit members and politicians during the legislative process because they help lower the transaction costs involved in political exchanges and generate a wide support base in favor of the legislation. The Obama administration knew that in order to achieve their end goal of healthcare reform, they had to utilize and appeal to special interest groups. When insurance, medical, and other impacted groups saw the reform was on the horizon, they quickly jumped at the opportunity to make their positions known. The Obama administration wanted to neutralize any stakeholder opposition and accomplished this by negotiating deals with healthcare industry groups to support reform in exchange for the promise of having millions of newly insured patients to treat. Interest groups such as PhRMA, Pharmaceutical Research and Manufacturers of America, American Hospital Association, America's Health Insurance Plans, Planned Parenthood, and AARP, among others, were in support of the bill. These interest groups were in support of the reform bill as long as their particular niche was protected and even enhanced. So it is not surprising that during the drafting and consideration process of the Affordable Care Act, it was reported that lobbyists representing these key interest groups almost doubled their weekly contributions to key committee members from $21,000 to $39,000 per week, while reducing their contributions to other senators by 20%. The increase in monetary contributions from these industry groups further proves that the marginal benefits that the legislation would provide these industry groups surpass the monetary costs that they would have to pay. These groups also wanted to ensure that the greater resources were flowing from the healthcare system without the accompanying heavy hand of government price controls. There are also many groups that were opposed to this from the very beginning. These groups included physicians associations such as urologists and orthopedists, some other insurance companies, and employer organizations. These groups were in opposition due to a couple main factors. First, their perception was that the added expansion to coverage outlined in the new reform would require higher taxes to be imposed in order to pay for them. Secondly, that these new expansions would lead to an increase in number of patients and further reduce the quality of care that they would receive. It can easily be concluded that interest groups played a vital role in the success of the Affordable Care Act. However, it was not only special interest groups that made this success possible, but the political exchanges that took place between Democrats and interest groups, which took the reform from the drawing board to reality.
When a new piece of legislation is proposed that is supposed to provide a benefit to society, there are times when instead it proves to be a benefit to the firms involved through the process of regulation. In terms of public choice, this is referred to as regulatory capture. This theory of regulatory capture can be used to evaluate the effects of the Affordable Care Act and the benefits insurance companies received. In terms of the Affordable Care Act, the proposed idea was to mandate health care of all citizens in the United States. The passed legislation requires all citizens and legal residents to have minimal essential coverage. While the mandate of health insurance coverage appears to be a benefit designed for the general public, it in turn increases the number of consumers that must purchase new insurance. On the side of the insurance firms, the transaction cost of reaching potential new consumers decreased with the mandatory minimum coverage. To the uninformed voter, this didn't appear to be an intentional act of the ACA. However, the theory of regulatory capture suggests that the industry is intentional when structuring the proposed regulation. Regulators that are used to analyze the industry and provide suggestions on regulation often do not have full information over the industry. In this case, the regulators will go to the firms of the industry to gather information, which allows for the firms to misrepresent their costs and details of the industry. Specifically, with writing the regulation that appears to serve the good of the people but results in the benefit of the regulated industry. The Affordable Care Act is an example of regulatory capture, and the firms within the healthcare industry ended up benefiting through the passing of this regulation.
With regulation comes the concept of rent seeking. Rent seeking is the act of allocating scarce resources in order to obtain a rent, which is an above average rate of return for an economic activity. In politics, firms will often seek rents through lobbying for various legislation and encouraging different regulations that will give them an advantage in their industry. ACA did not change how the healthcare system works. In the healthcare industry, the holy grail of rent seeking is to get one's medical device, drug, or procedure added to state health insurance mandates. This is because services, drugs, and devices that are included in the mandate are all covered in the person's premium. A premium is what an individual pays for their insurance either monthly or annually, and in return receives coverage for specific medical services, drugs, or devices. If something is incorporated into the premium, the direct cost of the item is hidden from the consumer. This is beneficial to pharmaceutical companies because it lowers the degree of competition by allowing them to hide the cost of their products to consumers, yet still get their products paid for. Therefore, pharmaceutical companies and medical professionals lobby state legislators in order to convince them to include their product or service in the insurance mandate. Prior to ACA, states determine what was included in the individual mandates. Under ACA, the federal government plays a role in determining what items must be included in your insurance premium. It is estimated that complying with the essential health benefits requirements accounted for 5 to 8% of premium increases in Ohio and Georgia, and 7 to 11% in Pennsylvania. These costs are the result of the expanded coverage. However, it's hard to determine if the expanded coverage is actually worth the cost because the direct costs of these products are hidden from the consumer just as they were prior to ACA. This expanded coverage is often unnecessary. For example, 4 states have mandated coverage for naturopaths, 3 for athletic trainers, 1 for oriental medicine, 11 for hair prosthesis, 4 for massage therapists, and 3 for pastoral counselors. ACA does nothing to prevent these types of services from being mandated. ACA simply adds on to these types of mandates by coming up with its own essential benefits that must be covered. Rent seeking results in a deadweight loss to the consumer, which is the difference between the monopoly price and the competitive price. In the case of insurance premiums, the monopoly price is the cost of your premium, which covers a variety of products and services, whereas the competitive price would be what an individual would choose to pay for insurance if packages were left to the market control. ACA and state mandates require services to be paid for by the consumer, even though the consumer might not ever need or even want coverage for those services. Money is spent by consumers for items that they may never get anything in equal value of return for. This is what results in the deadweight loss to the consumer. While deadweight loss to the consumer is the direct damage of rent seeking in the healthcare industry, the indirect damage that results is arguably worse. Rent seeking in the healthcare industry is extremely profitable. In fact, there are twice as many lobbyists of the pharmaceutical and health products industry than there are congressmen. Lobbyists tend to be highly intelligent and hardworking individuals that are the kind of people we would like to have driving forward our production. Instead, they are being used in the case of the healthcare industry to persuade congressmen to adopt policies that harm the consumer. These resources would have been used in market production to produce value to the consumers, but instead they are being used to capture a rent, which in turn reduces our potential economic growth rates.
In conclusion, we found that a lot of aspects discussed in public choice led to, as well as occurred because of the passage of the Affordable Care Act. First, special interest groups were vital to the ACA. They helped shape the bill as well as represent the views of those in support and those against universal health care. In addition, rational ignorance played a role in gaining public support for the ACA. The bill was written in a way that was confusing to the average voter, and so voters were misinformed about what ACA would really do and cost. The rational ignorance of the American people also contributed to regulatory capture. While it appears that ACA was beneficial to the general public because it mandated coverage for all, this was really more beneficial to the healthcare industries themselves by creating a larger demand for their services. Finally, ACA was unable to stop rent-seeking activity in the healthcare industry, and ultimately contributed to an increase in the kind of activity through its mandated coverage of essential benefits.